So very good evening, everyone. This is Dr. Singaram, your Paediatrics SS faculty. We have with us today Dr. Janvi Kumar, who has secured rank 7 in this recent NEET-SS exam. And she also had scored NEET-SS Rank 2 in the Pediatric Gastro Group. So welcome Dr. Janvi to the interaction and hearty congratulations to you.
Thank you so much.
So before we get started, can you please introduce yourself as to from where you did your undergraduation, post-graduation? Please let us know.
Yes, sir. My name is Dr. Janvi Kumar Sirwani. I am a resident of Ahmedabad and I did my undergraduation from Gandhi Medical College, Bhopal. I passed out in year 2022. After that, I joined All India Institute of Medical Sciences, Bhubaneswar in 2022. I recently completed my MD in September 2025. And after that, I have given this exam.
Okay. So right after completing your post-graduation, you've secured excellent ranks. So how are you feeling now, given that both the results are out?
So I'm feeling really nice, like really nice. Like everybody is happy, my family, everyone is really happy with the results. So I'm happy.
Yes. We from the Mado team also very happy to see you prosper in your career. Okay. So before we get started, can you tell us when did you start preparing actually for these competitive exams with your residency or after residency?
Like I was not preparing for competitive exams per se. Like during residency when I joined, I was focusing on learning the topics. Like if I was getting any patient, then I used to read that, and whatever discussions were going on in rounds in like classes. Like I used to focus more on learning clinical skills, learning about cases, learning about patients more rather than like just reading for a competitive exam. And like while coming out from residency, like this was not in my mind, like preparing for super specialty, but like as I passed out, I figured out that I want to do super specialty.
Okay, so it came naturally as you were you're doing your internship. During your residency, right? Okay.
Yes, sir.
Okay, right. So were you inclined towards any specialty while you were doing your residency, or how did you develop interest in studying further to choose your specialty?
Yes, so
Yeah.
during residency, I did not have interest in any particular branch per se. I was interested in learning clinical skills, learning about cases, learning about my own patients, and like I was focusing more on this academics part and some degree of research part also to some extent. So like more or less like residency only helped me like in every aspect. Like like I did not take super specialty. Like I was not learning for super specialty. I was learning for being a good pediatrician.
Okay. So I think the level of question nowadays they're asking is also more focused about approaching the patient rather than just straight away going into the disease per se, right? That is what I feel according to the recent patterns.
Yes, so like recently, like previously, when like I was seeing the PYQs, I was like the kind of I had a thought in mind that NEET-SS is going to be a bit straightforward, but this time it was not like that. It was
True.
more of a clinical version, like four to five line question, and then like think about what to do next. What is the best investigation? What is the next best diagnosis? What is your differential diagnosis? So it was more or less clinical. It was not straightforward, and it was not like textbook learning. It was clinical learning.
Yes. So I think it was more of like how we see in the ward rounds rather than actually a competitive exam level of question or like a pure MCQ type of question, right? It's more of patient oriented paper rather than knowledge testing paper, right?
Yes, sir. This time it was a good part that it was patient oriented and not just some straightforward facts. And like this time, one more thing is that apart from the clinical questions, few of the approximately 10 to 15 questions were from biostatistics. That is not what we usually expect in like NEET SS paper. But because like biostatistics part was being discussed during residency, and by doing thesis properly, like I was able to do those questions. So I did not read specifically for biostatistics and other stuff, but because of residency learning only, I was able to solve most of the questions.
Yeah, as you said, usually biostats are more asked in the INI-SS type of papers rather than this NEET-SS paper. I think this was a shift in the pattern, should be noted. You got a good number of questions in the INI-SS as well, related to biostats, right?
This time, like usually we expect more number of statistic questions in like INI-SS, but this time only one or two questions were there in INI. But NEET-SS there were 10 to 15 questions. That was a game changer.
Okay. So apart from learning in residency, did you have any particular strategy to appear for the exams or the preceding months before the exam? Did you adopt any particular strategy, or was it like a routine learning as what you did in your residency?
I completed in August end. So September I took a break. Then by October starting, like INISS was announced. So
Yes.
I started. So first I figured out a branch for which I wanted to appear for NEET. Like I don't. The best part is I don't have to figure out the branch. So, like, more or less, for INISS, I had read gastroenterology and general pediatrics part. So, for NEET-SS, I did one thing is that I used to give GTs a lot. Like, in one day, I used to give 2 to 3 GTs, and rest of the week, I used to select the topic from the GT only. So, for example, in the GT, if the question from pancreatitis is there, I will read that topic from Nelson. So this is how like I used to cover most of the GT topics by reading it from Nielsen or from Marrow videos or Marrow notes. And after that, I used to solve the particular question bank based on that those topics only, which I had already written in my notes that this topic had appeared in this GT. So in next GT, this topic should not be wrong. So I was able to cover most of the high yield topics in this manner. And apart from that, 2 to 3 days before NEET SS, what one new thing I tried is that I attempted most of the mini tests and subject tests which are there in Marrow. So like there were approximately 100 tests, like including both mini tests as well as subject tests. So what I was trying to do is I was attempting them, like I was not attempting it for like getting the questions correct. I was attempting it for learning, like as a part of learning aspect. So from by attempting these number of questions in last 2 days before NEET SS, I was into this MCQ training thing. The new part in this NEET SS was that questions were very lengthy, quite difficult, more clinical, and I was not able to complete 50 questions in a specific amount of time which they were giving. So that is why, because I have solved approximately whatever number of mini tests and subject tests are there on Marrow, I was in that mode only. Like I was in question solving mode, so I was able to I was not able to attempt all the questions. I had to leave approximately 9 questions unattempted, but that was okay.
Okay. So I think this is one of the unique things which I heard from the toppers in the recent times, like getting into the practice mode right before the exam, like few days before the exam, actually helps in keeping up with the pace of the exam, right? Okay. Okay. So your main source of preparations were from your own notes plus the GTs and the Q banks. Selectively, you started doing it from based on your review of the GTs, right?
Yes, sir. Like my main source, specifically my source was Nelson only. All the highlight topics that I covered from Nelson. Apart from that, Q bank, and also during residency, I had some like selected notes, like some guidelines. Like for nephrotic, we read specific guidelines. For like GER, we speak like read specific guidelines. For autoimmune encephalitis, we have specific guidelines. So I had a list of those guidelines. So because I went through it during my residency, it was easier to me to grasp the concept. And like because this time also, like few of the recent guidelines were also asked, so that was like good for me this time.
Okay. So you used to prepare notes even during your residencies also for selected guidelines and high yield topics, right?
I did not like make notes, but yeah, I used to like make folders in my laptop or in my tablet, the specific about the specific guidelines and specific topics, which are like residency PPTs and residency articles and whatever. I have used the sources that I was collecting it separately. So like that helped me, like revising it during the last few days helped me a lot.
So this time you said the questions were more clinical, but talking about the source of the questions, majorly I'm talking about, except for the guidelines part and of course the recent updates. Was Nelson the main source from where they were picking up the questions, or do you feel any difference?
Most of the questions can be done with Nelson only. Like most of the questions I was able to do, but because I had read gastroenterology in more depth, and this time like many questions were from gastroenterology, not only gastroenterology, to like from the systems which are connected with gastroenterology. Like there are many multi-system disorders. So because of my reading in gastroenterology, I was able to cover most of the topics as well.
Okay. That's nice. So, so because you're a topper in both the exams, can you guide our future aspirants regarding what sort of approach they need to make in case they start preparing from now for the next INASS as well as the NEET-SS exams, or what should be their approach to differentiate between the two exams?
For INISS, like what I felt is that approximately 60% of questions were from the specific field, which were like, for example, I have attempted gastroenterology. So approximately 60 questions were there from gastro, but those 60 questions were not superficial. Those were like they were asked in real depth. And
Yes.
other 40 questions, like more, I hear most of the aspirants talking that should we read general questions or should we focus on particular branch. So what my take from this exam was that if you have done your residency properly, if you have read the topics during residency, or if you have managed those patients, you'll be able to like solve most of the general pediatrics questions, apart except for vaccination that you have to revise before like 1 to 2 days prior. Apart from that, general pediatrics questions, like 50% of the questions can be covered using residency knowledge. And if you are thorough with one branch from which most of the questions will be asked, so that gives you a upper head. Like you don't need to separately prepare for general pediatrics for INISS per se, because whatever you have done till now in pediatrics, that is only going to help you. However, for NEET-SS, what I realized is pattern was very different. Like there were questions from all the systems. There were questions from rheumatology, nephrology, cardiology. Cardiology part, I felt in NEET-SS was quite difficult. Like it was difficult for me because we had less exposure for cardiology. But apart from that, questions are being asked from every system. There was no system left from which questions were not asked, including biostatistics, as I like told earlier.
Yes, yes. Yeah. Okay. So I think general pediatrics part is a must, and most of it you can cover from the residency part. And the specialty part also has to be included with equal weightage for NEET-SS. That's what you're saying.
Yes.
Okay, right, fine. So if somebody is in their final stages of preparation, like how often would you advise them to use the Q banks or the GT modules, or what do you think would be an ideal one right before the exam, like 1 month before the exam or something like that?
I would like to say that solve as many questions as possible. Maybe it is from grand tests or from subject tests or from mini test or question bank. That does not matter. But the thing is that you should be able to review those questions which you are solving and learn at least some aspect from that question. So, like from one question, you can like get from the explanation in that question, you get to read like approximately 4 or 5 things. You like get to know more. So like don't take it like a test, take it as a learning. Like yes.
Yeah, I do get that point, right? It is not just that particular question or the topic. It is like an overview of the topic along with some focus on the areas asked in the question rather than just only one part of reading. You should do it in a general way. That is what, right? Okay. So can you tell us, you used Marrow Q banks and GTs during your preparation. Can you tell us any feature you found very useful that gave you an edge while preparing for the exams?
Uh, yes, sir. Grant is like that. Like there are mock tests which are being conducted like in like 15 days duration or 30 days duration. That I like even if you are not able to like attempt when the test is live, you do attempt when the test has expired. So like and also if you are giving a grant test, do not take it like like I have got this rank, I won't be able to like get a good rank or whatever. Take it as a learning, and gradually as you keep revising the portions, like for example, like this week you are doing cardiology, so after 1 week again give another grand test and try to see what more number of questions you got correct from that cardiology part per se. So gradually as you go on, the number of questions which you are getting correct will keep on increasing. And so like one thing about grand tests is that it tests you, like it tests every system, and like from grand test, do not take it like a test. You take it like you are learning from it. And for example, baseline test you are giving. Next week you have planned cardiology. You read whole cardiology, then you are like give another test, and then try to see like from the what last week you have learned, what number of questions you have got correct. So that will give you motivation that I have studied this much and these number of questions I got correct this time, which I did not get correct last time. So that this way, like all the systems you can cover gradually. Another thing is that like discussion with people, anyone. It can be your senior, it can be your junior, it can be your batchmate, but like discussion helps in forming a concept, and you will be able to recall it better. Like for example, in residency, whatever chance I used to get, I used to teach my juniors or I used to discuss with my seniors any topic. So because I have discussed topics with them, I was able to recall it better while revising it.
Yeah, it's basically putting into practice what you learn in a way. Okay.
Yes, sir.
Right. So I think with what you're saying, like granters will help you to identify the areas where you really need to focus on, so that in the next GT you're going to appear, if you can correct that mistake itself, the overall number of corrects also will keep on increasing, right?
Yes, sir.
Okay. So at some point of time, everybody, while we are preparing or during a residency also, we tend to stress out or get burnouts. And can you tell us how you used to cope up those situations? Like what sort of methods you find really works for long preparation hours and strategies related to that?
The best thing that worked for me is that post residency, I took 1 month break. In that 1 month, I did not read anything. I did not think what I wanted to do further. And I went for a trip for approximately 20 to 25 days. So in that trip, I was free. I was able to free my mind. And after that, when I started preparing, I was in contact with few of my seniors. Rest of them I was not in contact with, but those seniors and juniors. So those few were the one I used to talk. I used to share my problems with them, and they used to, because they have passed that stage. I was like they were able to connect with me, and they'll tell me solutions that like it is like they will help you in some or other way. Another thing is that with my family, I used to play games. Like after, when I'm tired, I used to play games with my brother and my bhabhi. So like I used to play games during my free time with them. Like so approximately 1 2 hours I used to play games with them just to free my mind. So that also helped. Like we at home we used to play Ludo and various other games. So that with these recreational activities I was able to focus more.
Okay. So you should have your own set of stress busters which you should make while focusing on studies also. Right. Okay. Just one thing I wanted to ask is like as aspirants who are preparing for the upcoming exam, what do you feel that there is one mistake which commonly everybody does, but it could be avoided or it could be modified so that we can perform better in the exams? Which do you feel so is that area?
One mistake that I have been seeing, like people are making, is that they are trusting multiple number of sources. Like, for example, if they are doing this from one source, they'll trust it from other source whether any more information is there or not. So what is that? They are not trusting one source. If your source is Nelson, okay, trust it blindly. Do not read other books and just to gain more knowledge. Trust one source. For me, it was Marrow as well as Nelson, as well as the guidelines which are the folders of guidelines which I have made during my residency. So for me, that was the only source. So apart from that, I did not read anything during my preparation phase of NEET-SS. So like because I did not read from multiple sources, I was not getting easily confused. And because clinical knowledge that I gained during residency, that helped me, like because when I was in residency, one thing was that I have a habit of like thinking of a rarest diagnosis. So my faculties used to scold me like, Ki, is this how you should think or something like that. So because I used to get those scoldings, I was like, this time when I was attempting the paper, I was thinking like, is it a mistake for which I will get scolding or not? So I was able to arrive at a most common like answer. So
Yeah,
that helped me.
that's what our during our residency time, our professors used to say this very simple thing. If you think about common conditions, you'll be commonly correct. If you think about rare conditions, you'll be rarely correct, right? I think that applies to anywhere, right? Not just for a clinical science or our clinics. It is also applicable for MCQ exams as well, right? Because everyone has that thought in mind that they are going to ask something very different, very rare, something like that. But in reality, they're actually asking about the common topics only, but in a way that which we have to think differently. That is what I feel is being tested in the exam. Rather than entirely new topics are being asked. Of course, there are good number of new topics, but still, the ones which are usually asked are always there in the exams in different ways. That is what I feel. Right. Okay. Right. So, so one more thing I wanted to ask you is like, apart from residency, if any student wants to prepare for exams during their residency, right? How ideally they should begin with that, or what do you feel could be a correct strategy for based on the recent pattern of exams?
Based on the recent pattern of exams, like first thing I mentioned initially only, that focus on residency during your 3 years. After that, just like what I did was, when I started preparing for Peds Gastro per se for INI, is that I selected few of the like videos from of toppers from interview. Then I mentioned, like I made notes of my own, and like saw which sources are like matching. So for that, from most of the videos, I like got the information that most of the questions can be covered by Marrow as well as Nelson. So I chose those sources blindly. So because I chose those sources, I was reading and revising from those sources only. So I would like to say is the one mistake I'm seeing commonly is that they change sources commonly. So trust your sources blindly, and most of the questions can be covered from those two sources. And like Nelson, like there is no need to read Nelson from cover to cover. Like go through high yield topics. Most of the most common, like in clinics, what do we see commonly? Nephrotic syndrome, constipation, neonatology, common neonatal problems. Most of the questions are asked from those questions only. Like there are hardly questions which you will get from the rare diagnosis. Mostly questions will be asked from common diagnosis, which you are commonly seeing in your OPD as well as IPD practice. So like most of the questions can be attempted with that.
Okay. So sticking to the same source and focusing on the residency, and then towards the end, shifting towards the question mode, I think should be the strategy going forward. Right?
Yes.
Okay. Thanks a lot for sharing all your, approach to the exams and the strategies related to that. Now, what are you planning to take up in your career?
Like
Your
with INI, I have joined pediatric gastroenterology, but I'm still figuring out. Like I've not arrived at a decision yet. I'm trying to sort things out. After discussion with family, I'll decide further.
Okay. Okay, Dr. Janvi, thanks a lot for your time and giving valuable advice to our future aspirants also. And on the behalf of Team Marrow, I wish you all the best for all your future endeavors and for a successful career ahead. Thanks a lot for your time.
Thank you so much, sir.